This is my Biology 307 presentation. I decided to do it on the beginnings of cancer and the types of treatment. What is cancer and how is it found? What is it? Cancer basics. It is not just one disease. There are multiple types of different types of cancer. There's breast cancer, lung cancer, colon, skin, melanoma. There's multiple more that I'm sure everyone else has heard of. Stages of cancer. So stage 1, you hear there's 4 stages. So stage 1 would be cancer is a small and in one area, abnormal cells with potential to become cancer. So it's just the beginnings. They see something, but it's not something fully yet. Stages 2 and 3 are considered the same stage. The cancer is large and has grown into nearby tissue and lymph nodes. This is kind of more serious, but not as serious as stage 4. Stage 4 cancer has spread to other parts of your body, called advanced or metastatic cancer. This is where it's really serious and there usually isn't really much cure for this point. How cancer forms. How does cancer form and how is it found? Formation of cancer. A cell becomes more and more abnormal, old or damaged. Instead of dying off, they tend to live. And the longer they live, they kind of grow together and become a tumor. But leukemia, which is a type of cancer, does not form solid tumors like the rest do. So it's harder to find cancer with leukemia than it is with any other kind. How is cancer found? Physical exams are always recommended first because they don't have to do any long exams or any tests or anything. But if they do find stuff, they do usually a biopsy, or in some cases, like for breast cancer, they do mammograms, which is an x-ray of the breast. They usually can do MRIs or stuff like that to get more detail. Some examples of cancer are breast cancer, which occurs when abnormal cells from inside the milk ducts break out into nearby breast tissue. As cancerous cells grow and divide, they form a malignant tumor within the breast. So once again, all those cells that are supposed to die and don't go away, they stay together for longer. They form a tumor. And this is usually found in a physical exam. If they find lumps in a physical exam, they will do further testing with a mammogram, like I said, is an x-ray of the breast. Some symptoms that you should kind of look out for are swollen breast pain, skin irritation. There's sometimes weird rashes. Women are usually supposed to do normal checks on themselves. And if they find any types of lumps, obviously consult your doctor. The next is colon cancer. Colon cancer is a malignant tumor rising from the inner walls of your large intestines or rectum. Most of colon cancer forms from polyps. Early stages are treated by surgery alone because it's something that can easily be removed through surgery. Obviously, severe forms require chemotherapy, which can extend life expectancy if they can't find a better way to get rid of this, or it can reduce it and make it not come back. Some symptoms are constipation, diarrhea, rectal bleeding, any type of change in consistency when you poop or anything like that. Forms of treatment. So cancer can be treated in many different forms. There's always, I'm sure you hear about some of them, but these are how are all types of cancers treated, and how does this affect the body? Like long term, how does this affect your body over years? Treatments is surgery, there's radiation, chemo, immunotherapy, stem cell. These are all just simple examples I'm sure people have heard of when they hear about cancer. How it affects the body. Most people can get anemia. There's appetite loss. A lot of people can get bruising and bleeding. Hair loss is a huge one that people associate with cancer in general. Sleep problem, nerves problems. The list can go on and on. And these are my websites used. Thank you.